Factors responsible for congenital malformation. Congenital anomaly is defined as structural, behavioral, functional, and metabolic disorders present at birth. Types of anomalies. Malformation is a primary structural defect resulting from a localized error of morphogenesis occurring during 3rd to 8th week of gestation. Disruptions. Morphological alterations of already formed structures and are due to destructive processes. Deformations. Mechanical forces that mold a part of the fetus over a prolonged period. Oligohydramnios, producing clubfoot. Dysplasia. Abnormal tissue formation, e.g., congenital ectodermal dysplasia. Congenital anomalies can be of various types. Structural, where external form or structure is abnormal. Functional, where the function of the organ is affected, e.g., in hemophilia, a particular factor essential for clotting is absent. Metabolic, where there can be a defect in metabolism because of absence or defect in one or more enzymes. Causes of congenital malformation. In 40 to 60% of persons with birth defects, the cause is genetic factors, such as chromosome abnormalities and mutant genes, account for approximately 15%. Environmental factors produce approximately 10%. Combination of genetic and environmental influences. Multifactorial inheritance produces 20 to 25%, and twinning causes 0.5 to 1%. Principles of teratology. Genotype of the manner in which this genetic composition interacts with the environment. Developmental stage at the time of exposure. The most sensitive period for the inducing birth defects is the 3rd to 8th weeks of gestation, the period of embryogenesis. Dose and duration of exposure to a teratogen. Teratogens act in specific ways, mechanisms, on developing cells and tissues to initiate abnormal embryogenesis, pathogenesis. Manifestation of abnormal development are death, malformation, growth retardation, and functional disorders. Numerical abnormalities, change in chromosomal number. Aneuploidy, monosomy, loss of chromosome due to non-disjunction of a pair during gametogenesis, e.g., Turner syndrome, 45X. Trisomy, it is the addition of a 3rd chromosome to the usual pair due to non-disjunction, 47 chromosome. Trisomy of autosomes, e.g., Down syndrome, 21. Trisomy of sex hormones, Klinefelter's syndrome, 44 plus XXY. Structural factors. Translocation between non-homologous chromosome. Deletion. Part of chromosome is lost. Duplication within a chromosome. Inversion. Segment of chromosome is reverted. Inversion. Segment of chromosome is reversed. Isochromosomes. Centromere divided transversely, i.e., one arm missing and others duplicated. Environmental factors. Drugs. Thalidomide. Babies were born with deformed legs and arms. Damage to the ears, heart, kidneys, and genitals. Alcohol. Extreme alcohol use or even one binge drinking episode during pregnancy may cause the infant to develop fetal alcohol syndrome, FAS. Mental retardation. Impaired motor coordination. Poor attention, memory, and language abilities. Facial abnormalities. Widely spread eyes, short eyelid openings, thin lips. Tobacco. Low birth weight, increased chance of miscarriage. SIDS, sudden infant death syndrome. Behavioral problems, ADHD, short attention spans. Poor scores on mental tasks. Amphetamines, cleft lip and palate, heart defects. Maternal infections, rubella virus, cytomegalovirus, herpes simplex virus, varicella virus, HIV, toxoplasmosis, syphilis. Hormones, androgenic agents, anthisterone, non-anthisterone, masculization of female genitalia, diethylstilbestrol, DES, malformation of the uterus, uterine tubes, vaginal cancer, malformed testes. Maternal diabetes, variation of malformations, heart and neural tube defects most common. Physical agents, X-rays, microcephaly, spina bifida, cleft palate, limb defects. Hyperthermia, anencephaly, spina bifida, mental retardation, facial defects, isotopes. These risk factors include advanced maternal age, 35 years and older, a history of neural tube defects in the family, previous gestation with a chromosome abnormalities in either parent, and a mother who is a carrier for the X-linked disorder. Diagnostic procedures. Ultrasound can accurately determine fetal age and growth parameters and detect many malformations. Maternal serum screening for alpha-fetoprotein can indicate the presence of a neural tube defect or other abnormalities. Amniocentesis is a procedure in which a needle is placed into the amniotic cavity and a fluid sample is withdrawn. Chorionic villus sampling, CVS, involves aspirating a tissue sample directly from the placenta to obtain cells for genetic analysis.